Thank you. Senator Warren.
Thank you, Mr. Chairman. So we're here today to discuss a recent advisory that the U.S. Surgeon General has issued on protecting the mental health of young people. And there are a lot of important recommendations in this report, from how to treat mental health as an essential part of overall health. But I want to talk for just a few minutes about a recommendation for improving children's mental health that is powerfully necessary, but often goes underappreciated, and that is access to quality child care. The child care system in America is broken. It's hard to find. It's massively expensive. It's totally out of reach for most families. And wages for child care workers are way too low. And then the pandemic hit, forcing thousands of child care providers to close their doors, raising costs for the rest. Parents, women in particular, have borne the brunt of these policy failures. Dr. Murthy, helping families afford quality child care is important for a lot of reasons, like improving children's overall outcomes and letting parents go to work. But you say in your report that it goes beyond that. So can you just explain, why did your advisory recommendation include increasing access to affordable child care as a way to improve children's mental health?
Well, Senator, thank you for that question. I appreciate it. And you're lifting up something that I absolutely agree needs more attention. Here's why we included that recommendation. And I know this as a parent myself, that childcare is one of the greatest sources of stress for a parent when it's not adequately available. And when a parent is struggling with a high degree of stress and anxiety, that impacts children. We all know that, and we see that happening every day. That is one of the key reasons why affordable childcare is essential.
So when parents are struggling to find childcare, the financial and the emotional stress directly harms children. But let's say a family somehow manages to find decent childcare, they scrape together money to be able to pay for it. And while that fee is a lot for the family, it's barely enough for the child care provider to make ends meet. So the provider is struggling to provide enough staff and can't pay workers as much as they would make if they were working the checkout line at McDonald's. Dr. Murthy, your advisory also talked about the importance of investing in the child care workforce. What impact does it have on children when child care workers looking after them are understaffed and underpaid?
Well, Senator, children do best when the people caring for them are also doing well. When you are not being paid a living wage, when you are unable to do the basic things you need to support you and your family, that's extraordinarily stressful. That is anxiety-provoking. That is difficult. And it is harder, I think, for caregivers to do the job they want to do, which is to provide good quality care to their children, when they don't have an income that can support them and their families. So we have to take care of the people who are taking care of us and our children. That's what this is about.
Yep. We rely on child care workers to take care of our babies, to help them grow while their mommies and daddies are at work. And yet child care workers on average are only making about $12 an hour. We need to invest in child care so that we can hire people, so we can retain them, make decent pay and benefits, let them build expertise over time and improve the care that they give to our children. And right now, we have our toes on the line to get that done. A transformative investment in childcare and pre-kindergarten in Build Back Better, which would cut the cost of childcare for families and raise wages for providers. So, Dr. Murthy, in our remaining time, just the last question I want to ask you: what kind of payoff will this investment in child care yield for children, for parents, and for child care providers?
Senator, I don't know that I can count that high, because it's
a great answer.
It's a big payoff. I'll just lastly say this. I cannot think of a more important responsibility than caring for our children. And it makes sense that we invest in that area, but when we take care of kids early in life, they become young adults and older adults who are also have a greater shot at good mental health and physical health. If we've learned one lesson from this pandemic, it's that early investments in health and well-being are important, and childcare is an important part of that.
Good. These investments can't wait. We need to get this done. Thank you, Dr. Murthy.
Thank you, Senator Warren.
Thank you.